Thank you so much. If you are counting your steps and learning your genetic risk factors, that might be a good thing for your future health.
Then again, maybe not. I don't know. Joining us now with a healthy debate on data is medical reporter Liz Bonus. Liz.
This is really fun to talk about. Good afternoon to you. Good afternoon, guys. With so much information, you'd think we'd be dropping pounds, lowering blood pressure, changing our diet to reduce what we find out are our risk factors in our own DNA. But a recent commentary by the Canadian Research Chair in Health Law and Policy, a guy by the name of Timothy Caulfield, says, not so fast. He says there's a lot of evidence that since Fitbits have come out, we've spent more time sitting around. He says many people who find they're at risk for certain diseases that you can manage with lifestyle or a change in lifestyle don't make those choices. On the other hand, if we don't have data, we don't know if medications or health programs for certain populations are working. So today, with the help of TriHealth and BI3, both groups trying to make us healthier in the tri-state, we share a bit of debate on sort of what is around that data from tomorrow's noon show, What's Happening in Health. But part of the reason I want to talk about this is, let's start with the patient piece. As a dietitian, I always can see people come in and they'll have all their blood sugars listed. I'm like, do you know what these mean? Well, no, I just think they're cool numbers. Or I can watch the graph. We have so much more available, but there's a fine line, I think, don't you, to what helps and what overwhelms?
Oh, exactly. The problem is that, if you call it a problem, we have a lot more access to information, but unfortunately we've done a very poor job of integrating the information and making it meaningful to patients. And the healthcare system is a bit guilty of this. And patients have gone out on their own and tried to find more information. And we really are starting to catch up. And part of TriHealth's Population Health Initiative is to make sure we actually empower patients to get the information they need to have the kind of outcomes and lifestyle they want, instead of having a physician or provider tell them what they think is best.
And those numbers are important because they come back to you with feedback, and then sometimes that feedback needs to be fed to an organization like yours that might be funding a program. So you're like, without data, we can't tell if something's working.
Right. Our goal is to provide the funding needed to test and pilot new approaches, but we can't prove that they're sustainable and making an impact on health without measuring what we're trying to do.
Healthy debate, more on our show tomorrow at noon. That's moved from Sunday morning just for the next few weeks because we're making space as we're growing in time. You know what it reminds me of? There is a comedian who does this thing that he goes to the doctor's office. He says, every time the doctor tells me my Fitbit doesn't have enough steps, I put it back on the dog. And I'm like, numbers don't really mean anything unless you want to use them to make you get healthier. So I understand the debate, important to have, and that's kind of the stuff we're talking about.
All right.
If I get to the gym and I don't have my watch on, I'd say the workout doesn't even count.
I know, it's really true. Like, you feel lost.
You feel like you're not getting credit for it.
I know. Yeah, those steps didn't make it today.
Not buying into any of it, but thank you. All right.